let's kind of break this down. I want to be as fair as possible and not kind of out the gate attack this conclusion by just kind of, can you walk us through this? Is there any research that's at least like pointing in this direction, or research that's looked at this link between, the drug I can't pronounce, but we're going to call it Tylenol, and autism? Help us understand that.
Yeah, absolutely. So the long and the short is that the research suggesting a link between autism spectrum disorder in children and the use of acetaminophen, you and our president alike couldn't name that. Acetaminophen, which is the generic for Tylenol, causes autism. The studies are relatively weak and primarily show a correlation between the two things as opposed to causation. And that's a really important element for us to discuss today, because it's commonly a problem with the public's interpretation of clinical research studies, right? It's very easy to assess the presence of a disorder and look for a root cause. But if the study is not properly controlled in order to evaluate true causation, we can sort of jump to conclusions. And that's what we're seeing here. That's what all the scientific experts have sort of already relayed about the government's assessment of this correlation between Tylenol and autism in children.
Yeah. And when you're saying that, right, with correlation, I saw a funny meme about this online that essentially, like, some percentage of people who eat pickles get cancer, and everybody who's eaten a pickle, before 1901 is dead. So pickles must be causing cancer and death, right? That's kind of the point you're making about how the lack of evidence to say that Tylenol is the singular cause of autism, right?
Yes, exactly. And there are a lot of examples that are given, sort of like your analogy. A common one is that ice cream sales and shark attacks increased during summer months. So that must mean that there's a causation there, right? But really, it's just a correlative relationship. It doesn't mean that eating ice cream causes shark attacks, of course. I mean, the average person could surmise that those two things are not linked. Both are independently influenced by warmer weather, but one does not influence the other. And so when we perform clinical studies, we need to control for all of the variables as much as we can in order to understand what's really underlying a condition. Alternatively, we know that smoking does cause lung cancer. There are myriad clinical studies that demonstrate this. So that's a direct cause and effect relationship. But ice cream consumption has nothing to do with shark attacks. So that's a nice example to really kind of parse out the difference between a correlation and a causation.